Is your practice's workflow helping you focus on your patients, or is the process getting in your way? With everything from creating a patient's booking through to a settled account, your patient flow can either make you pull your hair out or focus on what matters most. This can help you get back to what you love doing, taking care of your patients. Meet Mary. She's experiencing symptoms of a UTI. Using the MyGC app, she makes a booking with her doctor. The MyGC app is integrated with the doctor's GoodX diary. This allows the receptionist to import Mary's details seamlessly and accurately into GoodX, which translates to less admin and better data integrity. That's not all. Dr. Nell has set up a questionnaire which is sent out to patients that have made bookings via MyGC, so that he has all the information he needs for an effective consultation. With GoodX's facial recognition feature, the web camera immediately identifies Mary as she walks into the practice. Not only does this promote security, but it also makes the receptionist's life easier by automatically opening the correct booking, allowing him to greet Mary by name. The receptionist marks the booking as arrived. The receptionist asks Mary to verify her information and sign the practice's updated terms and conditions at the MyGC kiosk. This is an effective way of complying with the POPI Act while helping you go paperless. After finishing at the MyGC kiosk, the receptionist directs Mary to the waiting room and marks her booking as ready, allowing the doctor to see that Mary is ready for her consultation. The GoodX VoIP system rings and recognizes Junaid's number. He needs a repeat of his chronic script and would like to collect it later this afternoon. During this time, Dr. Nell was busy taking a quick look at Mary's photo, clinical dashboard, and history. Now that the doctor is well prepared, he is ready to greet Mary. Dr. Nell can walk straight towards Mary, greeting her by name, with previous visit context in mind. As the two sit down in the consultation room, Dr. Nell gathers details on the main complaint, history, signs and symptoms. Moving to the examination bed, Dr. Nell will be using a wireless Bluetooth blood pressure monitor that feeds its readings directly into GoodX Web. As Dr. Nell attempts taking Mary's blood pressure, he notices an abnormally shaped mole on Mary's arm and uses his GoodX Capture applet on his phone to take a photo of it. The phone applet allows the secure taking of photos without them being stored on the phone. After returning to his desk, Dr. Nell uploads the photos and starts completing the general examination form. With integrated clinical notes that are simple and easy to use, GoodX gives doctors the power to enhance the clinical experience, reduce note-taking time, and improve efficiency with a fully paperless practice. The blood pressure monitor has finished calculating the patient's blood pressure and heart rate. Now the BP results can be directly imported with the click of a button. The doctor asks the nurse to assist Mary with the urine test. The doctor continues with the physical examination notes. Upon the patient's return, the urine test results can also be captured. Thanks to clinically driven billing, Dr. Nell can simply add the diagnosis and make use of his clinical procedure macro that he has set up for running a drip. With a click of a button, the doctor can add the billing lines to the patient's invoice, making billing accurate, fast, and convenient. Creating a prescription is quick and easy. The diagnosis from the general examination form has automatically loaded into the script. A script macro for UTI quickly loaded amoxicillin for the UTI. Luckily, an attention pop-up is warning the doctor that Mary is allergic to amoxicillin. The script macro also loaded Brufen for the pain, but sees that the drug interaction checker gave a warning that these two medications have an interaction with each other and have some side effects. With the prescription done, Dr. Nell can finish off with his electronic signature that is protected by his security PIN. Dr. Nell can then simply email it to her. Dr. Nell quickly creates a sick note for Mary and emails it to her. The last form that Dr. Nell will be completing is a pathology order to investigate kidney function and possible causes of chronic dehydration. The doctor can easily make electronic orders and receive results from the 4 major pathology labs. Dr. Nell IMs the nurse to come fetch Mary to do a drip procedure for her dehydration. With the invoice finalized, it can now be submitted to Mary's medical aid. The receptionist can see that there is a patient liable outstanding amount and checks the color-coded claim response. Before Mary leaves the practice, the receptionist informs Mary about the outstanding amount. A quick card payment from Mary settles her account. The receptionist finalizes the account with a receipt. After Mary's consultation, Dr. Nell sees that there is a new high-priority task pinned to the diary. It's Junaid's request to have his prescription renewed. With the chronic script management tool, this can be done in a matter of seconds. After finishing the task, Dr. Nell can close it. Once the task has been closed, the task manager will automatically mark it as done, minimizing administrative duties. When Junaid arrives at the practice, the receptionist is ready with his printed and signed script. Thanks to the facial recognition function, the receptionist knows that he is giving the script to the correct patient. Great news! Mary's pathology results have been automatically imported as a task in Dr. Nell's diary. By navigating to Mary's pathology results, the doctor can view the results and write down an interpretation and plan. Dr. Nell then IMs the receptionist to create a follow-up telemed consultation to discuss the results with Mary. The receptionist calls Mary to schedule the follow-up consultation. GoodX telemed enables the doctor to do online video consultations with their patients. It's almost time for Mary's telemed consultation. Luckily, she has received a booking reminder SMS that also contains the consultation link. For the telemed consultation, Mary will connect to the consultation from her MyGC account, and Dr. Nell will connect directly from GoodX. Dr. Nell can see that Mary is in the telemed waiting room and joins the call. During the telemed consultation, the doctor will be able to share their screen, send messages to the patient, and minimize the call window. Once the consultation is done, any necessary documents, like referral letters, scripts, or sick notes, can easily be sent to the patient via email or SMS. Dr. Nell then invoices Mary for the telemed consultation. But how does the patient pay for their telemed consultation? Simple. The receptionist will be sending a payment link to her. Now, Mary can just click on the link to make her payment. These links save the patient time and effort by making secure online payments quick and easy. That means better cash flow and less time spent following up on outstanding accounts. While the receptionist is busy with his daily ERA management, he notices Mary's payment, which he can then allocate to Mary's account. So, with booking, capturing clinical notes, billing patients, switching claims, and finalizing your accounts, we try to make every aspect of the patient flow a good experience so that you can focus on what matters most to you.